Okay, so as we continue our journey through the cardiovascular drugs, we now reach our beta blockers. So what is a beta blocker? Before we get into that, let's go to the cardiovascular system. So cardiovascular drugs, or CV drugs for short, you'll see that abbreviated sometimes. They work either directly or indirectly to treat or manage diseases and conditions of the cardiovascular system. The cardiovascular system consisting of the heart, blood vessels, which are your arteries, your veins, and capillaries. A good way to tell the difference between them, the arteries are always red. The veins are generally perceived as blue, even though that's not really their real color. And then your capillaries are the connection between arteries and veins. Those are those little blood vessels. Arteries go away from the heart, veins go towards the heart, carrying that deoxygenated blood back to the heart so it can be reoxygenated and then pump throughout the body to supply all of our muscles and tissues with oxygen as well. So among the most common cardiovascular drugs we have are beta blockers. You will see them everywhere. They're very, very often prescribed, and they work by reducing the oxygen demands of the heart muscle. So they help the heart not work as hard to pump, giving it a bit of a break, and that can help with a number of cardiovascular conditions. So it can be treating hypertension or high blood pressure. It can treat arrhythmias, which are irregular heartbeats, and it can also help prevent another heart attack. So many times people who have had a heart attack in the past will be prescribed beta blockers to keep that from happening again. So we have a few notes on beta blockers. They have to be, beta blockers, they should not be discontinued abruptly without medical supervision. So that's because of a potential for rebound hypertension. So if you were to stop taking a beta blocker cold turkey, then what does the body do? Well, the body was compensating for the slowing of the heart rate, and it's not as used to having to pump as hard as it was when it was on the beta blocker. So rebound hypertension, when your blood pressure was low and managed with the beta blocker, if you were suddenly to stop it cold turkey, it could go very, very high very quickly. So whenever people are on beta blockers, you start them, the common phrase is start low and go slow. So you would want to start them, eventually taper up until you get to a therapeutic effect. You taper that dose up, and then you taper them off of the beta blocker, probably on a week-by-week basis, roughly, to eventually discontinue it. All of the generic names for beta blockers end in the suffix LOL. So you'll see all the lols. As you can see, beta blockers make me LOL. That is a fun pharmacy shirt. Get it for your pharmacist, and they will love it. The beta blockers also work by blocking epinephrine's effects on beta receptors within the heart. So that's what they're blocking, right? The beta receptors accept epinephrine. Epinephrine, you can also call it like adrenaline. That's what makes your heart beat really quickly. By blocking those receptors, the epinephrine doesn't have as much of an effect on the heart. By doing that, it's able to slow the heart down, lower the blood pressure, and stop the heart from working as hard. Now, common side effects, surprise, surprise, one of them is low blood pressure. Low blood pressure, the term being for that is hypotension. So you can see that right there, your top number and bottom number, the systolic and diastolic numbers, this would be considered low blood pressure. It's 84/61. Now, that's not necessarily unhealthy, and some people normally have low blood pressure. I mean, that's quite possible. I know certain members of my family, including myself, my blood pressure sometimes hovers around like 90, 95 occasionally. And then I get to a doctor's appointment and they'd be sort of like, oh, are you okay? Like, do you feel a little faint or anything? It's just how I normally run. So thankfully I won't be needing a beta blocker. My body does that anyway. But for people who are not used to it or who are suddenly put on beta blockers, they have to be aware that they might have lower blood pressure than normal. So they might have some dizziness or fatigue upon standing, especially. Also a slow heart rate, which is of course the point of the beta blocker, but also something to keep in mind, slow heart rate or bradycardia. And lastly, lots of people who take beta blockers always feel a bit cold. So cold extremities, because the blood is not pumping as vigorously through the body. So that kind of makes sense. Cold extremities are another common side effect of beta blockers. And our examples of beta blockers, we have quite a lot of them, but as you see, all of those generic names end in LOL. So we have atenolol, carvedilol, metoprolol succinate, metoprolol tartrate, just two different salts of the same generic medication. Toprol XL is the extended release salt. So if someone is on extended release metoprolol, you know it's the succinate and not the tartrate. We have nadolol as well, nebivolol, and propranolol. All very common drugs, all beta blockers, all work to slow down the heart. Thank you very much.